Welcome to Radiologist, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satish Krishna. Have you noticed this interesting quirk about families? The eldest or the oldest child receives all the attention because parents want to make sure that they do everything right. The youngest child receives all the love, not just of the parents, but of the entire extended family. And you know who goes ignored and overlooked? It's the middle child. It's a common theme of not just families, but of a lot of other things in which the portion in the middle often does get overlooked. For example, most of you can tell me who the first man in space was, and most of you can also tell me who the last man in space was. But what about the people in the middle? It also goes for movies. The director spent a large amount of time trying to get the first part amazing, the climax amazing, but what about the middle? And this is true of careers in general, physician careers in general, and radiology is no exception. What defines mid-career and how to handle the complexities, how to navigate mid-career. To speak about this, we have with us today Dr. Rakesh Mohankumar, who is an MSK radiologist extraordinaire. Rakesh, it's great to have you here with us today.
Thank you, Satish. Thank you for the kind introduction, and it's my pleasure being here.
All right, let's address the elephant in the room first. What is a mid-career radiology? Like, when is mid-career? How do you know that you're right in the middle now?
Yeah, it's a very interesting question. Before this, I never thought of my radiology career as divided into phases, like an early career, mid-career, or a late career. I thought it was one smooth pathway. But, looking around and asking people, yes, there are differences between the career phases in radiology, like early career, mid-career, and late career. So what is mid-career? That's a question that I've asked myself as well. People have arbitrarily defined mid-career physicians as someone who's over 5 years from starting their job, or some say even 10 years from starting their job to until 5 to 10 years before retirement. So that's a large chunk of your working career as a physician, and it entails most of your working life as a radiologist as well. Now, how do you know when you become a mid-career radiologist?
Exactly. Like, how do you figure it out?
Yeah, exactly. I mean, I had to look back at my career. I mean, it's been 10 years since I started my career as a staff radiologist here at UMIT. So I look back, and it wasn't one day I woke up and said, yes, I am a mid-career radiologist.
Because in flights, it's very straightforward.
Exactly.
The pilot switches off the seatbelt sign, and you know that, okay, the takeoff is done. Now you're in the mid-flight.
Yeah.
Whereas here, you don't have like a sign which says, okay, today morning, you're in mid-career right now.
Yeah, absolutely. Looking back as an early career radiologist, when you start your job, you're this young, dashing, new radiologist. And from your own point of view, you want to show everyone or prove to everyone that you're the right person for the job. So you almost run around like a headless chicken, trying to do everything. And, when people ask you to do everything, your answer is always invariably yes. And you try to fit in everything into your life. And then when you pass that phase, and then that's when I think about, yes, you probably turned your career into into the mid-career. How I felt was, it's always in hindsight. These are the things that I think changed my path from early to mid-career. So clinically, for example, you feel like your work is being respected by the clinicians. So the clinicians value your work, and they come to you for advice based on what you have done. So you feel like, yes, your work is being recognized by your colleagues and the clinicians, and also your colleagues in radiology as well. They ask your advice, your opinion. And you also develop a skill set and you know where your strengths are and where your weaknesses are, and you will sort of migrate towards your strengths because you're not that young, dashing, early start radiologist. You want to carve a niche path for yourself. So that's another thing that I felt that subconsciously I changed. And that's probably because I was changing from early to mid career.
Mm.
And it also translates from the clinical side to academic and to an academic side. So all of us, we work in an academic setting. So we have all those roles as well. So on the academic side, you get invited to collaborate in research with other clinicians because they understand the value and the quality you provide. And also not just research opportunities, you get asked to present at professional society meetings or present at residency teaching, fellowship teaching programs, and get invited to meetings and didactic lectures. So all of that as well. And you get asked to take on some leadership roles that come through your way as well. I think all of this, for some, it may happen in the early careers, but it mostly happens when you pass that early career and you've established yourself and you're visible to everyone, and your reputation is starting to be visible to everyone as well. And I think that those are the things that I felt made me feel that switch from early phase to mid-career.
Well, that's a great answer. That's one interesting thing, though, because some of it is a little bit heterogeneous across practices. Because one thing you mentioned is that your own radiology colleagues would come and get advice or showcases to you. One thing which is amazing about our place is the incredible collegiality of people. The very first day I was working, Dr. Tony Hanbridge, who's like considered one of the greatest of all times, he just called me and he's like, "Hey, Satish, what do you think about this case?" And that was the way things are practiced here. So, maybe that's really not applicable. But I think what was amazing about what you said is that in the early career, you feel like you have a chip on your shoulder that you have to prove something to the world. Whereas in mid-career, you feel very confident to say, "No, I'm not going to do this." Because in the early career, you're never going to say no. You're going to keep saying yes. So I think that it comes with getting the confidence to know what you want in life, what you want in clinically, what you want academically. I think maybe that's the biggest thing. But how do you go from an early career in which you have that chip on the shoulder to getting self-content and that confidence in mid-career? Because that's not an easy switch to pull off, right? Like how do you handle that transition? And is it just that you notice that in retrospect, or is that something which people should start working on even in early career?
Yeah, I think it depends on individual personality. Some people are confident right from the start, and certain others are not. We've seen different people come through our departments, different radiologists, and everyone has their own individual personality. Some people are confident right from the start. They know exactly what they want. And some people take some time, it may be months or years, to find out that they belong here and what they want to do, what they want their career to be.
Mm-hmm.
So I think it depends on individual personality, but it's always a good thing to self-reflect or reflect on your own skills and have goals for yourself. What we know is, throughout our career, until you get into a staff job, you always had goals. You're in medical school, yes, you had 5 years, I will be a doctor. So you always had short-term goals, like 5 years. A residency, 5 years. You will finish residency, and then a 1 year of fellowship. Yes. So you had fixed time frames of goals. But once you start your career and inside the early phase or the early honeymoon of early phase radiology is finished, then it's like, okay, what do I do now? There's the time is now sort of in front of you, but there's no set target. So I think that confidence comes from setting goals and boundaries for yourself. So identifying your skill set and what you're good at. And, once you pass that early phase, you become more confident and more competent. And the other thing that you are in the early phase of radiology is you have this fear of making mistakes.
Absolutely. Yeah.
And once you pass that, that fear changes because you become more confident, more competent with experience. And you probably have a broader toolkit to handle cases that you may not have had early on in your career. So you become much more competent. So that focus of the fear of making mistakes, it shifts to becoming more competent and staying current in the radiology world.
So I want to dissect these two things because we're talking about the early career as the honeymoon phase, but again, it comes with incredible pressure, that fear of making mistakes. And not just that, it affects patients, it can affect clinical care, but you're also worried that you're going to be judged by your peers.
Mm-hmm.
And when we were talking on this podcast with Dr. Shoyang Liu, we were talking about how this shift from a fellowship to an early career phase is like tightrope walking. With fellowship, you have that safety net.
Mm-hmm.
But at the start, you don't have the safety net, and that's just psychologically pressurizing. However, with mid-career, it's a little bit different because although there are no safety nets in the early career, you have this invisible safety net that you're still early in the career. So let's say that somebody who's brand new maybe doesn't know how a certain procedure is done. You're like, oh, yeah, they're just getting their foot in, they're just getting used to it.
Mm-hmm.
But doesn't mid-career come with incredible pressure? Because now that you're in a mid-career, if you now come and say that, hey, I don't know how this is done, people are going to judge you. And does it come with a lot of pressure? Or are you now confident of saying that maybe I don't know this and I'm okay because I can find an answer with that? Where does it stand? And are people different there as well?
I think so. I mean, that's a very interesting question. What I think is, even though you may feel like once you pass this early career or into the mid-career, you may feel that your daily life is a routine every day, but
Mm-hmm.
it isn't. Every day for us radiologists is different. Every patient you see is different from the last patient you saw.
Absolutely.
Even if it's the exact same case you're doing or exact same procedure, everyone is different. So that, I think that's the beauty, and that's the challenge of being a radiologist. It doesn't feel mundane at all. Every working day is different. So I think that's the beauty of. So you don't. Some people like routines, but I don't like routines at all. So every day I come in to work thinking, what's in store for me? What's the surprise today? I think that brings me into work, and that's the enjoyment of coming into work as well. But even more, as you mentioned, once you gain experience, you are becoming more and more confident. So with the number of years passing by, you can handle challenging situations and pressure at work, and you have developed coping mechanisms for stress relief or challenges or adversities that may happen at work, and that will help you maintain a balance when it comes to challenging situations at work. And also, as you said, early career radiologists get a lot of support from other staff members. I'm working in a division where, in terms of career pathway, I'm the youngest.
Mm-hmm.
So I have a wealth of experience to ask and gain advice from. So, and that's been like that from day one, and to this day it continues as well. And it's not just a one-way path. They ask me for advice as well. I'm lucky to be in a division and the department as well, where openness is appreciated, and everyone helps each other, and there is no finger pointing at anyone if you make a mistake. Mistakes are part of growing up and part of radiology. What we strive to do is to reduce the amount of mistakes, but
be
you can
better
never
today than we were yesterday.
Exactly, and we can never eliminate mistakes. So it's promoting that culture. Making a mistake is okay as long as you own up to it and be honest with it. Everyone makes mistakes, so it's giving that freedom to everyone and that confidence to everyone that helps reduce that fear of making mistake. And sometimes a fear of making mistake can prevent people from progressing. They don't want to take on new things because of that fear of not being able to succeed in that. I think that openness really helps, and that, I think, is a great benefit. to our department.
That's amazing. So I think, like, to rephrase what you said, both the early career and mid career comes with incredible challenges, at least in terms of clinical work. Whereas in early career, we're often worried about, oh my God, how am I going to deal with this? In mid career, you're actually looking forward to the challenge. You embrace the challenge because that's what makes things from going stale or boring. You're like, okay, what new challenge can I face today? What new problem can I solve today? And that's just great.
Yeah.
And moving on to the mentorship piece you're talking about, at every stage of the medical journey, it's quite easy to figure out what the advice has to be. Okay, to a medical student, how do you become a good resident? To a resident, how do you be a good resident? How do you transfer to fellowship? To a fellow, how do you go into a staff? And to an early staff, how to get your bearings in. But in mid-career is like a weird area in between. Where do you go to mentorship for? Because there are lots of programs available through a lot of societies in which there are mentorship tracks for people in early career. Mm-hmm. But I don't think I've ever seen any place where there's specifically catered advice offered to mid-career track. And this is especially true because you point out that everything in the medical journey has so far been straightforward, whereas in mid-career, it isn't. As you rightly point out, there are clinical challenges, there's leadership challenges, there is academic challenges. So now you're at a fork in the road. It's not just a fork. There are so many paths going. You don't really know what to choose. This is just brand new. You have the confidence to face it, but we still need mentorship. How do you go about finding mentors and how is it set up in like big divisions like this?
Yeah, that's a very good question. Mentorship, I believe, is even more so important in the mid-career. I feel like, the mid-career, not just radiologists, mid-career clinicians, they form one of the largest workforce in the department. And unfortunately, they are sort of largely ignored or they go under the radar. Early career, you are this we've got this new dashing young guy. He's excellent. He'll be a superstar in radiology. So the focus is on them. And then on the other end, you have the late career radiologist who's like revered, respected. They are well known around the radiology community. But everyone else falls in between who don't seem to fit anywhere and are largely ignored. So, and unfortunately, a lot of burnout happens in mid-career as well, which is a problem. And one of the reasons for that is the lack of support that mid-career physicians and radiologists in particular have, and also the lack of mentorship. Mentorship is vital for mid-career radiologists. Once you're past that early career, you have to decide what you want to do with your career until you get to retirement. And you can become stale and stagnant through the way. So it's very, very important, especially getting mentors who have been through that phase. They can give valuable insight, advice, and support to help you guide through that way. And it doesn't necessarily need to be one mentor. You can have a number of mentors. So you as a radiologist need to identify what your goals are and what your skill set is and find a mentor who fits into that goal that you are trying to achieve, and then get advice from them. And, as you said, there may be opportunities like going into leadership or administrative. Some of the mentors who are experienced in that may be able to open doors for you that you may not be able to open yourself. So finding a mentor is very important. And the mentor doesn't need to be in radiology. It can be someone in clinical medicine or even someone outside clinical medicine. And as I said, it doesn't need to be one person giving you all the advice. As a mid-career radiologist, you have challenges both in and outside work. So you need a mentor for all of that. So you can, I can choose one person. I can have 2 or 3 of my friends or who I call mentors, who I can take advice for for financial
Yep.
financial advice, or someone to talk about professional life. I know who I can find, and who will genuinely give me good advice about what my career pathway should be, or do you think this is a good idea? So it bounces back ideas back and forth. I think mentorship is key, and especially you can feel lost without a mentor. So it's very important to identify a mentor or mentors who can guide you through this professional pathway in the mid-career.
That's great advice, because I think for the most part, for a medical student, you're a resident, if you have one or two good mentors, it usually covers most of the bases because that's what you need. But mid-career is just so widely diverse, and that next step is so complicated with so many pathways that, as you point out, you probably need a whole group of mentors. You're not taking too much time off each of one, but you need like a little bit of advice from each of them so that you can put together and figure out where you're going. So if anybody in leadership from the hospital, from the university, from any of the academic societies are watching this, please send some love our way for the mid-career radiologists, mid-career physicians, because you put together incredible things for the early career and the late career physicians, but the mid-career physicians are kind of hanging around in limbo. So please send us some love. Try and figure out some mentorship pathway to be able to take us to the next level. Right. So talking about these dashing, rising stars, in early career, if you draw a curve, the trajectory is like this because you're learning stuff very quickly, you're doing things very quickly. But in the mid-career, as you point out, although there are clinical challenges, for the most part, you're quite comfortable with them. And often I think that life seems to plateau like this because you're not challenged as much anymore. You're confident, you're comfortable in what you're doing. And human beings are creatures of routine or habit. And when things get comfortable, we kind of tend to stay like this. We kind of plateau. And as you point out, lack of mentors can be problematic in reaching the next level or keeping that growth trajectory kind of going up. But when we see ourselves plateauing, and I think that's often what's called as a midlife crisis as well, because we kind of plateau in that way and we just aren't challenged as much. Because I think there was this weird paper which once said that human beings at any point of time should always be challenged 4% more than what they can do. Anything more than that becomes too challenging. Anything less than that, it's just too easy for us. But how do you kind of break those plateaus in mid-career? And how do you keep yourself going? Not just clear directions, but also just the motivation.
Yeah, that's an excellent question. Career plateau is it happens to everyone at some phase in our career. It probably has happened to me, but it's not at the point where it was upsetting me or holding me back. But it's important to recognize that when what you said was absolutely true. In the early career, you're trying to do everything, so you try and work hard, impress others. At an academic center, you will be pushing out publications, and then once you reach that mid phase, you sort of plateau where you will be just coming in, doing your work, going home, and there could be a situation where you lose interest because is this what I want to do for the rest of my life?
Yep.
That is a real issue. So that's when you reflect and see, okay, what am I good at? What other skill set do I have that I can use in my career apart from what I'm doing right now? So that's what I thought when I hit that sort of a plateau. And some of the things that I did was by accident. It came my way, and some of them I pursued. So education was a big interest of mine. So I took that in, and I was invited to professional society meetings to give didactic lectures. But also from an education point of view, I took an interest in our residency program. So I became a part of the residency program committee, and I'm the coordinator for the PGY1 residency group. So I do their reviews every 6 months and connect with them often. So that is very, very motivating for me to see these young budding residents come through our department. I'm also taking part in comms interviews every year, including file review as well. So that's also a very interesting topic to me. And the other thing that I got involved was, and that came by accident, is to collaborate with a medical arts company. So there's a medical illustration company that does illustrations based on imaging.
Okay.
And mainly for medical legal cases to be presented at the court of law. So they need to show pictures or illustrations of a particular injury. So they asked me if I could act as a consultant, providing support for imaging. So, helping them identify the pathology on imaging so they can make drawings out of that. And that was a very interesting topic to me. I'm not getting involved in the medical legal aspect, but I am doing imaging and telling them, okay, this is where the abnormality is, and they will make a drawing out of that to be presented in the court of law. But some people may go even further and take part in medical legal activities. That is also something that you can use to diversify your career. The other thing that I do on my clinical side is quality and peer learning. So I'm the lead for the musculoskeletal division, doing the quality and peer learning activities in the department, in the division as well, and presenting at the department meetings. So these are some of the areas that I diversified in order to take, if you want to call it, the monotony of work, and to sprinkle some other stuff into it. And the other thing that people always miss to do is keep yourself current. I think that is very, very, very important. When you're in your residency and fellowship and early career, yes, your knowledge is at your peak. But once you hit mid-phase, you can just lose that.
Yeah.
And it's very, very important to keep yourself current, because your credibility depends on being current. Because as you know, medical imaging is, it's going at a fast pace. New technologies, new imaging modalities, and so in order to stay current, you have to keep yourself current by going to professional society meetings, attending, research presentations and review lectures, and keep yourself current so your reports have credibility.
That is absolutely true, because maybe that's actually even the definition of moving into a mid-phase. Because when I started, the first few years attending all these conferences, I would hardly go to a single lecture. One of the main reasons is because these conferences are amazing for networking, because that's where you meet all these people who can eventually become incredible mentors. You hear their stories, you see what the path they have traveled across the United States, across the whole world. You get to meet a lot of people. It's ripe for mentorship. So I would just stay outside, chatting with those people, getting to know their stories, hardly attend a lecture, because during fellowship, I put in the work, so you already know what is there. But there comes a certain period in which you're like, maybe I should start attending these lectures again, because it's been quite a few years now. And I think that's clearly defines transition into a mid-career. But I really love what you said about that self-reflection, because I think to break plateaus, that's a great advice you gave us. Self-reflect, see what you're good at, not necessarily what you're good at, what you would like to do, and then just go ahead and do that. And just like financial advice, just diversify your portfolio, have everything at hand. But this diversification does come with challenges, because now mid-career, you are taking care of family life, taking care of kids, taking care of your clinical work, which was always there. But now more clinicians come to you. You get invited for more of these lectures to give. You have more leadership roles now. You're doing QI, you're doing stuff for an external company. You're pulled in multiple different directions, which is amazing, which keeps you challenged. But at the end of the day, there's only 24 hours a day. And this can get taxing, because if I just take vacation for 1 or 2 days, then there are like 200, 300 emails in my inbox, and it gets really challenging to allot the time. And that's kind of where we get stressed and burnt out. I know that mid-career does come with confidence, but still, because of all this diversification, it needs attention and splitting attention to multiple things. And how do you handle this, and how do you prevent burnout in the mid-career?
Yeah, that's an excellent question. And as I said before, this is the largest group that suffers burnout, the mid-career physicians. And the one thing that we didn't talk about during when we were talking is work-life balance. And that's key to prevent burnout. Because the problem with mid-career is that your responsibilities are increasing outside work as well, in your personal life.
Yep.
You may have a young family who demand more time of you. Kids need all your time. So finding work-life balance is crucial. And that's where you need to take stock of what you're doing at work and outside work. And you have to find a work-life balance. And most of the burnout comes when that balance is lost. So it's very crucial to have a proper time management plan and to dedicate time to work and outside work. Because, you can't have an imbalance and try to think that, everything will be fine. That's what ends in burnout. So the time management and proper work-life balance is incredibly useful.
And allotting time, not just to work and personal life, but also to yourself.
Totally.
Because I think that's probably the first thing we tend to sacrificing. We're like, oh, there's so much to do. You know what? Let me just not go to the gym. Let me not go for the walk I always wanted to go. Let me cut short on the vacations and do this stuff.
Yeah.
I guess that's, yeah.
Yeah. And with that, what we said was, we gain the confidence, not just in clinical work, but you need to have the confidence to say no to certain things. You as you said, we self-reflect and identify what your skill set are. So if somebody approaches you to participate in something that's outside your skill set, don't be afraid to say no. This is not what I want to do. You need to, this is your career. You have to fork your own path and you identify whether this is beneficial for you or not. In the early phase, you don't think that way. You want to please everyone.
Yeah.
But in the mid-career, does this work for me? That's what you need to think.
Yeah. Is this useful for me? Or if it is potentially interesting for me? If it's no to both, it's better to say no at that point. And I think that in mid-career, you have earned the cachet, earned the right to say no.
Absolutely.
So in terms, and I know that it's a difficult question or even a difficult statement putting somebody in the mid-career. But here you are, the expert in mid-career. What are the most valuable lessons you have learned? And if there was any advice for radiologists or even for physicians who are right now in the early career, and like it or not, they will have to transition to mid-career at some point. What's the most important advice or set of teachings you would give for them?
Okay. Yeah, it's a very good question. And I don't know if I'm the right person to take advice from, but my advice is based on the lessons I've learned, transitioning from early career to mid-career. The one thing I've learned is have goals for yourself. And, goals can be, okay, I want to do work on a particular topic, or I want to go into administrative field or leadership, and define what success means with those goals. You can have a target, but if you don't have a goal and what that means in terms of success, it's not going to be fulfilling. You could say that, okay, I'm going to publish 30 papers. And you can have targets like that, but you need to have short-term targets as well in terms of, and you need to define what success means to you. And then, as I said, continuing education, that is crucial because you can get left behind if you're not keeping yourself current with the latest advancements in medical imaging, which is growing at a rapid pace.
Every day there's something new to be learned.
Exactly.
And when I was younger, I thought I was able to keep up with everything. But with all this AI coming, it just is incredibly challenging keeping up with every single thing. Like I've published on LLMs But yesterday, somebody was showing me some new thing which had come in LLM, which I hadn't even seen before. And I was like feeling so far left out. It is difficult.
It is difficult. And it comes from clinicians as well. And your clinicians will come and ask you for something to be done in a particular way because that is the new teaching or the new method of management. And you have to keep yourself current to provide good support to them as well. And the other advice I can give is, we talked about mentorship and networking. Networking can be by going to meetings and mingling with experts and peers in the field. So to gain insights about what's going on in the radiology world. And,
that culture should be encouraged because we teach trainees and residents to be good with books, to be good with patients, to be good teachers, to be good researchers, but we don't necessarily teach them how to network, how to reach out to people. We just assume everybody knows how to do it. And some people are good than others. We need to teach our residents and fellows to know how to network. Like going to these conferences is not just about listening lectures, which you can do even here. They can approach you and you would teach them exactly the same thing, but it's mainly for that networking opportunities. And I think that that's something which we need to encourage our trainees to do and probably even teach them as to how to do that.
Yeah, absolutely. Yeah, I think it's very, very important to have a good networking system. And then, lastly, but perhaps most importantly, is to have a good work-life balance and look after yourself. You only have one of yourself and you are the one leading this career. So it's very, very important to look after yourself.
Amazing. It's your life.
Yeah.
So just choose the best way you want to lead it and you can lead it.
Yeah.
That's amazing. That's great advice. Those are a remarkable set of advice which you just listened. All these pearls put together as to how best to navigate this mid-career phase, which, like it or not, everybody is inevitably destined to land. I did tell you that the middle phase of anything is slightly overlooked, and that is true of mid-careers. However, the one thing which I did not tell you is that the middle phase is usually the one which is most beautiful. Because think about life in general. You're born and then you have your early childhood, which you don't really remember. And then you're old. But the best years of your life are the ones in the middle. And it's up to you. And the possibilities are infinite, which is exactly true for mid-career as well. You have infinite possibilities. It is up to you to break out of the plateau and to do something with your life, to make it the most beautiful you can make it. And we did talk about midlife crisis or a mid-career crisis. But as Rakesh pointed out, the way out of that is diversification, to see where you're interested in, where you would like to grow and move in those directions. And to be in that place in which you have such a lot of paths in front of you, you want to be a leader, you want to be a researcher, you want to be a teacher, it is best to be in an academic center because it has all these paths laid out for you. And if you would like to be in an academic center, there is no better place for you to be than University of Medical Imaging Toronto, which is the largest medical imaging group in Canada. And I can assure you that we can change your mid-career crisis into mid-career bliss. Ladies and gentlemen, that was Dr. Rakesh Mohankumar, extraordinaire MSK radiologist, and me, your host, Satish Krishna. See you on the next one.
You were listening to Radiologists, a podcast by University Medical Imaging Toronto, the largest medical imaging group in Canada. Produced by Ina Levchuk. Learn more about us at universitymedicalimagingtoronto.ca and follow us on social media @Imaging Toronto.